All right, I'm Dr. Waters here at Indy Spine Rehab, here with Taylor and Travis. Thanks for being the cameraman, Travis. We've got the Mobility Y Leopard Claw today. Stainless steel, which I like. I also like the gunmetal. But we're going to use this today on Taylor's. She's got some foot pain. So we're not going to call this anything specifically. I don't like to call it plantar fasciitis or anything like that, but we'll just call it foot pain. The structure I'm going to treat a lot of times with this is going to be soleus and posterior tib, and that's tender a little bit right there. So we'll scrape up into that. I like to do it on the side because I can get that posterior tib, and then I like to get the soleus starting here and then typically with a bent knee. So I do scrape into the bottom of the foot, but it's highly painful. I don't like to do it. We'll do a little bit today, just for giggles here, but I've got some cocoa butter. I usually like the field foam. I don't have it in this room with me. If anyone wants to send me more, they can. But basically, I'll start with just kind of detecting where some of the spots are, so you can feel right in there. After I detect that spot, I'm going to kind of desensitize it, so I'll start going a little bit more aggressively, trying to kind of numb up the area almost, but it'll start to get a little irritating and see the petechia, the redness starts to happen. And then we'll start to degristle a little bit more. So detect, desensitize, and then degristle. And you can really feel the gristle right in there. And this is where I like to use kind of the edge of the tool right off the back of the tibia and kind of get in there. Doesn't take a lot of force. Now again, she could do this to herself, and I recommend that you do. Just stay away from the bone, and if it feels sketchy, it probably is. If it gets numbness and tingling, you're probably hitting saphenous nerves, so stay away from it. And I'll spend, a good 30 seconds to a minute here. You doing okay?
Mm-hmm.
And if I wanted to, again, this is pretty aggressive getting into it like this. If I wanted to, I could flip it on the other edge. And again, I always like to keep the bevel up at 45 degrees and get onto that more aggressive convex side. Just changes the angle. You gotta stay off the bone though, still. Again, I usually prefer to keep it on the concave side and use kind of the end piece on this. And the bottom of the foot, we're not gonna do too much. We'll just get into it a little bit right in here. Typically, we're treating this flexor mass or this flexor aponeurosis. It's not actually the fascia. The fascia is there. We're treating through the fascia. After you treat the fascia, you want to treat the masca. That's a terrible joke. I'll add a little movement to this too. You doing okay?
Yeah.
You can hear that gristle. Good. Flip over on your stomach. Now we'll get to the soleus. A little bit more cocoa butter. And again, I like to bend the leg. Let's get around like this. And kind of relax it. So the soleus is going to be the calf underneath that doesn't cross the knee. So we'll need to keep the knee bent to stay out of the gastroc. Now I can keep her leg straight and get into the gastroc because that's going to affect the bottom of the foot. But I like the soleus to be kind of the only thing that I'm really hitting. And again, underneath the soleus, you could affect still the posterior tib and the flexor digitorum and the flexor hallucis longus up in there because that is right underneath the soleus. But right now, this is the soleus. You feel that?
Mm-hmm.
Okay. So again, detect. So we're kind of finding some different spots here. For her, it's going to be right in the middle of the soleus. And then if you were a little bit more superficial, you'd feel it's between where the gastroc kind of starts forming into the Achilles. So that tendinous muscular kind of junction. But now we'll desensitize a little bit. And again, this is where I like the tool. I was using it with one hand, we're reinforcing it the other earlier, and then I was using it with one hand. Now I can use it with two hands. I don't have to switch tools. Same tool. Before I'd have 3 different tools for this. Now I'm going to degristle. You doing okay, Taylor?
Mm-hmm.
You can feel it right in there. It's still mostly in that posterior tib. But right in the soleus there too. She's going to be a little sore after this. Good. Good, so we'll leave it at that. After that, I'll have the patient go ahead and stretch straight leg and bent knee. The bent knee is going to get more of the soleus and the posterior tib, so we'll have you stretch the rest of the day, keep it moving.
Okay.
And then she can treat this up to 3 times a week, so basically every other day. I don't like them to do more than that because, again, it's like overuse. Even if they want to do it every day, they shouldn't. So, any questions?
No.
All right.
Thank you.
Yeah.